Good evening to one and all. Thank you for joining with us. I welcome you all in today's live Facebook program on fatty liver, what you should know. Today, our speaker for the day is Dr. Zubin Dev Sharma. Dr. Zubin Dev Sharma has done his MBBS, MD in Medicine, DNB Gastroenterology, and is currently the Associate Consultant Gastroenterology at Medanta Institute of Digestive and Hepatobiliary Sciences. Sir has numerous research papers and publications on his name. So on this note, I would like to hand over the session to Dr. Zubin Dev Sharma.
Thank you very much, and I thank you for giving me this platform to talk about a topic that is something which I really feel strongly about, and it is something which is very common in our society, and it's something that we meet every day, we see every day, but we still don't understand it enough, and it is one of those silent killers all across the world now actually, and also in India. And for years together patients suffer from it and they never realize that they have this problem. So the topic that we are going to discuss today is fatty liver. So it's very common to have an ultrasound report with you, and you go for your annual health checkups that come across in your companies or your job profiles. In those annual health checkups, you frequently get an ultrasound done, and you see a report of fatty liver, and even the doctor who is doing the ultrasound tells you, oh, it's a routine finding, and it's not something to be alarmed of. Yeah, it's not something to be alarmed of, but it is a finding. And like any other finding, it has its implications, and we need to look deeper into it. So I will try to cover it in a very simple layman language or very plain language to make you understand what exactly fatty liver means and how you should approach it. Fatty liver, by its simple name, means there is some amount of fat in the liver. So some amount of fat in the liver is a normal thing. But when it is detected by an ultrasound, it is always abnormal, and we need to find out why. So it is fatty liver in itself at that point of time is not something to be concerned of or not something to be scared of, but it is a marker for some other serious disorders. Having a fatty liver means that there is some amount of insulin resistance in your body. When I say insulin resistance, that means that you are predisposed to many conditions, which also includes things like sugar or diabetes. It includes heart problems, cardiovascular problems. It includes brain problems like cerebrovascular problems or atherosclerosis, like tight heart veins or coronaries and all that. So you will be not only predisposed to a liver problem, ना सिर्फ आपको liver problem हो सकती है, आपको heart problems, आपको brain problems, आपको blood vessels की problems भी हो सकती हैं. So plus diabetes. So maybe today you don't have diabetes, but over the years you might be ending up with a diabetes. So it's like a hint. It's like your body is telling you, okay, something is going wrong, and that is where you need to start intervening. So that's why when you first find a report of fatty liver in your hand, please don't ignore it completely. Yes, don't be alarmed, but don't ignore. So you need to be knowing about it, and you need to know what to do with that report. If a patient comes to me with a report of fatty liver on ultrasound, I would first look into his overall profile. What is his weight? What is his nutritional status? What are his eating habits? And what are his risk factors for diseases, the ones I mentioned. So I will look into the medical language for it is, I will look into his metabolic profile. Metabolic means I will look into his how what are his sugar levels, what are his cholesterol levels, how is his heart, how is his blood pressure, and how is his brain function. So all these things I will want to look into it. Few years before all this fatty liver talk came about, we only used to focus on the liver. But over the years, we have understood as doctors that it is that liver fatty liver is one of the sign of a disease which affects all over the body. So we should not be narrow minded and not only focused on the liver, whereas we should also focus on every other organs, the one I mentioned. So we will definitely look, you should definitely look into your lipid profile, your cholesterols, your, highly sensitive CRPs, your homocysteine levels, your echocardiography or an ECG probably. Next comes is what you can, do if you have a fatty liver. So after you have after you and your doctor have, discussed together and you have analyzed all this stuff, you also need to understand what you can do. Exercising is very important. Amount of weight loss to be done is very important if you are obese, and some habits have to be curtailed. So which patient, so who is more prone to develop fatty liver? If you are overweight, if your weight or BMI is more than 25, then definitely you are predisposed to develop fatty liver. But that does not mean that fatty liver does not occur in patients who are not overweight. There is a concept of lean BMI. Lean means that patients who are thin but still have fatty liver. So not, everybody can have fatty liver in that regard. But yes, if you are overweight, if you are diabetic, if you have other conditions which affects your metabolic profile, you definitely are predisposed to develop fatty liver. So that those are the persons who do tend to develop fatty liver. Then, does it run in families? Yes, like obesity can run in families, fatty liver can also run in families. So it is not like one hit. ऐसा नहीं है कि आप सिर्फ खाना ज़्यादा ज़्यादा खाते हैं या आप मोटे हैं तो आपको फैटी लिवर हो सकता है. Obesity be or fatty liver also has a multi-dimensional pathology. It is your calorie intake, your physical exercise, your genetic profile, your eating habits, your exercise regime, your stress levels in your mind of the work you do, and all these things put together they actually harm you, and they all things put together decide whether you will have fatty liver or you will not have fatty liver. So once you are diagnosed with fatty liver and once your risk factors are identified, next thing that you have to find out is how you can treat it. So there are various methods to treat it, and the first and the foremost and the most important thing is to exercise and to have a healthy lifestyle. In today's era, we don't have too much of time. I'm a doctor and I myself know that even I don't have that much time to really work out, to really go around and exercise. But I tell you, if something that can really help or something which can really work out to help you treat with your fat liver is your exercise regime. In whatever way, you should find out at least half an hour for yourself in a day and try to do at least a walk. If something more than that, very nice. People usually come to me and they tell me yoga and all that, and that I do yoga. So yoga is good for your overall musculoskeletal flexibility, but is it enough for your physical fitness? No, it is not, really not. So you need to really work harder than that. So anything, swimming, exercising, cycling, running, whatever works for you, whatever you feel is good, please do it. And that is the most important intervention you can actually do for fatty liver. Then we have to ascertain the grade of fatty liver, and we have to ascertain how you whether you need medical or drug treatment or not. For that, you will need a few tests. You test like you might need a fibroscan, which can tell you how much amount of fat is in the liver, what is your stiffness of your liver. You need a blood test like liver function test, and you would also need sometimes you might need an MRI or a CT also, depending on case to case basis. So after that, there are some drugs which can really work, and there are drugs which your doctor needs to really decide and whether you merit for a medical therapy or not. And there are a lot of drugs which are currently in the pipeline in the research level, and which would come up in next few years, and would definitely change the paradigm of treatment of fatty liver. But as a layman, as a patient, what I need to know today is that having a diagnosis of fatty liver is not just a routine finding. It needs to be looked into. it should be identified as a risk factor. भाई समथिंग इज गोइंग रॉन्ग. अगर मैं सिंपल लैंग्वेज में बात करूँ, अगर घर के किसी प्लग में स्पार्किंग हो रही है, यू विल नॉट इग्नोर इट. आज स्पार्किंग हुई है, हल्की सी हुई है, 1 सेकंड के लिए हुई है, बंद हो गई है, बट येस इट कैन बी अ हार्बिंगर फॉर समथिंग मोर सीरियस. इट कैन लीड टू अ फायर. It can similarly, fatty liver can lead to liver cirrhosis. And if liver cirrhosis happens, it is an irreversible finding. You can't go back. Then you start managing a complication. So today, if you have fatty liver, please go to your doctor, talk to him, make sure that he also takes it seriously, and you also take it seriously. Become more fitter. Identify your risk factors. If you are smoking, if you have significant alcohol intake, if you are obese, try to reverse those factors. You can't change your genes, but you can change your reversible factors like smoking, alcohol, obesity, and all that stuff. So that is a broad overview over how fatty liver exactly is, and we can take some questions if they're coming on. I think Vibhor and Vismay can take up for that.
Right. Thank you so much, sir, for such a thoughtful session. And we have some questions. I'll take it up one by one.
Yeah.
So the first question is, sir, is fatty liver related to genetic issue, or is it like hereditary?
So as I said, कि fatty liver is not a single pathology. ऐसा नहीं है कि भाई it's just obesity. So genetics also play a role, but it is not a single definition treats all. So there is some genetic component to it. There is a genetic component to obesity also, but it is not the only thing. There are certain genes like PNPLA3 and other which have been identified in patients who have more fatty liver, but those things is not what I would, as a doctor also or as a patient also, would want to focus into, because that's not something which is reversible. And in fatty liver, that's not the only thing that is there to cause you a fatty liver. So it has to be some more factors. There is a concept of a two-hit hypothesis, that one, you have an intrinsic ability or intrinsic predisposition to develop fatty liver, and second hit is something environmental. कि मेरे जीन्स मुझे फैट की तरफ या मोटापे की तरफ लेके भी जाते हैं, लेकिन मैं खाना भी ज़्यादा खाता हूँ और मैं एक्सरसाइज नहीं करता हूँ. सो येस, देन आई विल डेफिनेटली हैव फैटी लिवर. वेरे समबडी कि हाँ, मेरे जीन्स मुझे शायद प्रीडिस्पोज करते हैं ओबेसिटी के लिए, बट मैं डेली एक्सरसाइज करता हूँ, मैं खाना ज़्यादा नहीं खाता हूँ, तो दैट आई विल डेफिनेटली नॉट गो टू फैटी लिवर. So it has a genetic component to it, but it is something which should not be a very point of focus for as a patient.
Okay. So next question is, can ultrasound helps in detecting cirrhosis? I had done my ultrasound last month and my findings were fatty liver only.
So ultrasound is very important to detect cirrhosis, but usually it detects cirrhosis when it is a full blown cirrhosis, like it's really at a very high stage. So if you have been diagnosed with fatty liver, the first thing that I will probably will do apart from the blood test will be a fibroscan. It tells me what is your current level of fibrosis. Fibrosis will not be picked up by ultrasound very easily until they are doing something called as an RFI, ARFI, which is not available in every ultrasound machine, or the radiologist might not spend that much time to identify RFI with you. So fibroscan will tell you what exactly is the fibrosis level. If it is an there is something called as an F1, F2, F3, F4 fibrosis. If it is an F4 fibrosis, then you will probably be having findings of cirrhosis, and that ultrasound can detect. If you have a complication of cirrhosis, like fluid in your tummy, like ascites, and if you have a veins are dilated, those things can definitely be picked up on ultrasound, but very early cases might not.
Right. Sir, next question is, what is the right diet for a fatty liver patient? I am 45 years old.
Very good question. This is very important. There have been three guidelines. 2016 Asia Pacific guidelines came, 2017 I think the European guidelines came, and 2018 the American guidelines came. And the crux of all those guidelines has been that your if you want to go down the route of diet management of a fatty liver, your diet should be somewhere between 700 to 1000 caloric deficient. Matlab, if I am eating 2000 calories today, my diet should be having somewhere around 1000 to 1300 calories to have approximately 7 to 10% of total body weight loss or an excess body weight loss, and that is what is important to have. Reverse fatty liver or reverse even some amount of fibrosis. How do you manage it? ये तो हो गया साइंस की बात. How do you actually end up doing it? The most important thing in Indian diet is carbohydrate. It is not actually fat. And over the years, over so many years, we always been told that fat is bad and fat is bad. Yes, fat is bad, but what is much more worse is carbohydrate. You should, and what is carbohydrate? Carbohydrate is everywhere in Indian diet. आप चीनी खाते हैं, आप चाय में चीनी लेते हैं, दूध में डालते हैं, मिठाई में डालते हैं, आटा, breads, baked stuff, your ice creams, everything is carbohydrate. So what you need to cut down more importantly is carbohydrate. If you can decrease your carbohydrate intake by approximately 40 to 50%, automatically your diet will become hypocaloric and you will start losing weight. So that is most important in my opinion. Rather than focusing on fat, until and unless you are really heavy fat eater, like you take fried stuff every day. I'm Majority of patients in my practice and in my experience are not worried or not really heavy fat intake patients. They are more of carbohydrates, so carbohydrate should be cut down.
Right. So next question is, how often do you go for liver biopsy before starting pharmacotherapy in suspected Nash?
So honestly, very rarely, because it is an invasive procedure. It involves poking a needle inside the liver and taking a piece. That is usually needed in common practice, as where there is a confusion between an autoimmune hepatitis versus fatty liver or Nash. And those patients really need biopsy. Why? Because in those patients, you if it's an autoimmune or a autoimmune hepatitis is a condition where the body attacks her own liver cells. So if that is the condition, the drug therapy is totally different. You would probably be given steroids and drugs like azathioprine for management of autoimmune hepatitis, whereas for fatty liver you would not be given all those drugs. So that is one indication where I will probably end up, and that is the most common indication where I will end up doing a liver biopsy. Other than that, there are certain research settings where if I have to use some newer drugs available which are currently in phase 3, phase 4 trials, and if I want my patient to be on them, in that cases we probably will need liver biopsy. But for purely diagnosing liver biopsy for Nash or fatty liver, I would not do a liver biopsy. There are other tests which are now available. There are blood based markers also. There is fibroscan or RP also. So it's very rarely that only for diagnosing Nash I would need a biopsy. That is a rare indication now.
So next question is there any surgical procedure or any medication to treat fatty liver?
Yes, so as I said that there are some drugs which are available for fatty liver. There are drugs like vitamin E, there are drugs like saroglitazar, and there are other drugs which are in pipeline, which are there, but they have very certain indications. So not every fatty liver patient is, an indication to start on these drugs. So your doctor was the best guy to judge it. I have in my mind that in whom these works. Think like if I have to start somebody on salbutamol, I will probably look into their triglyceride level. I will look into their diabetic status.
I think we lost connection. Uh, So request all the participants to stay connected. Sir will be reconnecting in few time. I would request all our participants to stay connected. There is some connectivity issue. Doctor is rejoining us very soon.
Can you hear me?
Yes, sir. Yes, sir. We can hear you.
Sorry, I just had a
Yeah.
internet issue.
So, right.
Are we back live?
Yes, yes, you are back live, sir. So, shall we continue with the questions?
Yeah. So I was talking about the surgical indications.
Right, right.
So surgical indications is like there are bariatric procedure for weight loss, and there have been a lot of push towards using these surgical procedures for Nash also, and I think they will get approved in some amount of time. There are newer endoscopic procedures which are now available for weight loss, which is something like endoscopic balloon insertion or endoscopic sleeve gastroplasty. I think we have been doing it quite frequently now, and all over India there are multiple centers which are doing it, and that should come up as one of the treatments for F3 F4 fibrosis. There have been very nice publication which have been which has come from our center, that we have used balloon as a bridge towards liver transplants for patients who are very obese and they need to lose their weight. So yes, it is actually coming up now. Yeah. Can you hear me?
Yes, sir. Yes, sir. We can hear you. So, we'll take the next question, sir. So, the next question is, do you keep obeticholic acid in armamentarium for NASH? And when do you prefer it over other drugs?
So OCA or obeticholic acid has been like recently, used or studied for fatty liver or NAFLD. So it for last I think six for almost a year it was in vogue for and a lot of trials were going on. So FDA has is still studying it. They have recently had a second or a third discussion on approval of OCA for as an indication for NASH. So see, the results are equivocal. It has shown some amount of benefit to be used in fatty liver. It has some significant side effects in the form of increased amount of urticaria or itching that might happen, particularly if we go to higher doses. And if you go to that doses, then it creates a problem. So I don't routinely use it, but yes, sometimes I do use obeticholic acid.
Okay. Sir, next question is it right to say that NASH is directly proportional to cardiovascular diseases?
Absolutely right. As I told you in the beginning, that Nash is actually a harbinger for cardiovascular diseases, and it is one of the markers for it. So if you are diagnosed with fatty liver, you should be really looking into your cardiovascular risk profile.
Sir, other question is, how dangerous is fatty liver? Currently, I have grade 3 fatty liver and my age is 40.
Fatty liver, if you have grade 3 fatty liver, yes, it is a marker for something more dangerous. You might be ongoing into developing cirrhosis, and I would really work hard to identify along with my doctor what are my risk factors for which I can reverse. If you have significant overweight, and if you have significant diet issues, I will definitely work towards them, and I will try to identify those risk factors. It is dangerous if it is checked, it is unchecked, and if it ends up being cirrhosis. If you I give you a simple example. One of the most common indications to undergo a liver transplant today is liver cirrhosis because of Nash. All over the world, not only about India, particularly in US and European countries. It's actually much more common indication than alcohol, than hepatitis B or hepatitis C. And in my opinion, in next 5 years in India, it will become the number one cause of cirrhosis. If it is still not, I think it is still the number one cause of cirrhosis.
So next question is there any management difference in diabetic and non-diabetic NASH?
There is some guidelines which are different. Particularly drugs like pioglitazone or saroglitazars should not be used in patients who are non-diabetics. But yes, if you talk about overall principles of management, they are almost the same. And if losing weight and lifestyle interventions exist in both, and hypocaloric diet exists in both, carbohydrate deficient diet exists in both. But drugs, the choice of drugs, like if you're diabetic, if you have hypertriglyceridemia, if you have Nash, I will be using sargotazar very early in that setting.
Okay. Sir, next question is there any role of nutrition or dietitian in fatty liver disease?
So very important role. I think it is something which we should be looking into, because as I said, lifestyle intervention is the most important thing. If you are not intervening in with your lifestyle, and that also includes exercise, it also includes diet, it also includes your stress levels. If you're not working towards all of these things, then you are definitely at a loss. And if a dietitian can help you, if a diet chart can help you, if you can't do it yourself, some patients really can't make out on their own. But if they can't, if a dietitian can help you, please get in touch with a dietitian. So yes, nutrition has the most important role and I told you, decrease your carbohydrates. Identify what is your carbohydrate intake. Pastas, Maggies, pizzas, breads, baked subjects, sugar, mithai. Nutrition is the most important if you want to treat fatty liver.
Sir, we'll take one last question.
Yeah,
So the question is, can fatty liver affect lean people as well?
absolutely. I told you there is a concept of lean NAFLD, or it is also called as MAFLD now, or like metabolic associated fatty liver disease. So lean people can also get fatty liver. They have some genetic predisposition that their metabolic profiles are different, and they can have fatty liver. The management, the principles remain the same. They are the ones who actually develop cirrhosis earlier than patients who are obese, because it's not only they have less amount of reversible factors. They don't have that much of diet issue. They don't have that much of an exercise issue. So whatever factors are there in lean people, it is more dangerous, because you are not there's no reversible factor to reverse them easily. You can't change somebody's genes. If they have genes to attend to have fatty liver, they will end up having it. And these are the patients, people who are lean NAFLs are the ones which are more difficult to treat.
Right. Thank you so much, sir, for addressing all possible queries. And thank you so much for such an insightful session. I'm sure this session will be very helpful for patients of fatty liver and their caregivers. I would also like to thank all our participants for joining us. And to stay updated on liver health, NASH, NAFLD, do like and follow our page NASH 24/7. Thank you so much. Thank you all. Thank you, sir.
Thank you so much. You're